Thank you all for joining us again this evening. This is County Executive Mark Molinaro. I want to mention that we're joined today nearly virtual person, by Dr. Neil Wythian. Dr. Wythian is the county's Commissioner of the Department of Behavioral and Community Health. He is an infectious disease doctor, as if we had planned to have him at this moment, at this time. But his life experience and, of course, the great professional staff at the Department of Behavioral and Community Health have been invaluable over these last several weeks. Joining us on the phone this evening to assist in answering some questions regarding business activity is Assistant County Executive Ron Hicks. Ron oversees our economic development work and has been tasked with working with our partners in the Think Dutchess Alliance for Business in communicating with our business community. And so tonight we want to get you updated on where we are, the status of activities here in the county. As always, I want to thank our American Sign Language interpreters for joining us. We are 6 feet apart, as we have been now, twice a week for however many weeks, 8 weeks, I think. 8 weeks? You don't know. I like engaging with them. It's, as you know, on every Wednesday and Friday, we go live. So tonight you're joining us. Again, this is County Executive Mark Molinaro. Those of you on the telephone, thanks for joining us. Dial 0 on your phone if you'd like to ask a question. You'll be asked to record that question, and then we'll bring you live. You're joining over 5,000 of your neighbors. We'd like to get you caught up. First, let's start with some of the data points that I think you'd like to hear, and certainly important to us monitoring activity. We'll bring that up for those of you on Facebook. Just to confirm, we have now tested how many? 27,000 individuals have received a coronavirus COVID diagnostic test in the county since the beginning of this crisis, this pandemic, and we've identified 3,825 positive cases with now 1,559 active cases. It's important to recognize not only that we will continue to see positive cases as testing continues, and it's important that if you feel that you've been exposed to the disease or are experiencing any of the symptoms, that you do seek testing. But in mentioning that, as we test more, there will be more positive cases. For us, the goal has consistently been to monitor the severity in the hopes of ensuring that we don't overwhelm our hospital system and to slow the transmission. And as you can see, over the course of the last several weeks, we've been on a steady decline in active cases, active hospitalizations. And I'd obviously like to recognize the fact that sadly we have now seen 138 individuals who have succumbed to the disease. So let me jump right in. As you know, the state of New York has identified 7 benchmarks by which regions across the state are measured. Dutchess County achieved all 7 of those benchmarks last week, and on Saturday, Governor Cuomo, in a call with the county leaders in this region, confirmed that, in fact, the Mid-Hudson region would begin the reopening process with beginning Phase 1. Phase 1 began yesterday. We were given the green light to begin that phased, slow, incremental reopening, and that began yesterday. I want to be clear, and I know that there are views on either side of this particular issue. First and foremost, this is not a throw the door open process. We do recognize the need to be incremental. We want that to be as fast as is responsible. But it is an incremental reopening and reactivation of activities in our community. At the same time, we want to be cautious and very careful about our next steps, which is why, as a community, we're going to continue to encourage the use of face coverings. We continue to encourage social distancing, and we continue to encourage, sort of limiting that physical interaction as we proceed with reopening. And I promise, as we take these next steps together, While we may not ever return to what was prior to March of this year, we will get closer and closer to it. And that, of course, is the goal as we take these small and incremental steps forward. The other is I do want to say, I know that there are those who feel like phase one, the first step of business activity, is very nominal. And I know it's easy to sort of dismiss perhaps some of it, and I'd ask you not to do that. Number one, there are thousands upon thousands of construction workers, whether they're contractors on small housing projects or perhaps replacing your front porch or putting siding on your house. There are also large building projects now that were on the sidelines for the last 2 months that are now activated. Dutchess County, prior to the pandemic and the onset of this crisis, had nearly $5 billion worth of construction projects underway. Half of those were sidelined and now begin that process of moving forward yet again. Manufacturers that were not deemed essential were not open, and now they can be, and that, I think, is important to remember. A lot of small manufacturers throughout Dutchess County with hundreds upon hundreds of jobs and individuals now able to return to work. And so while some of us may not see some seismic shift in the activity underway throughout the county in this first initial step, there are, however, there are thousands of people now going back to work, and those individuals are seeing a real important change in their lives. And now our goal and the task for all of us is, if we remain diligent, if we remain careful, we'll be able to, again, as fast as is responsible, take these next steps together. And so I do want to encourage you to visit dutchessny.gov. On the Dutchess County website, you'll find not only ongoing updates regarding coronavirus and our response to it, but you'll also see information for small businesses and business owners. A list, and for all of you, a listing of what falls basically under what stages, what business activity are now activated and able to begin their return, and then also references to the phases and the metrics so that you can kind of monitor where we are. As you likely know, each of these regions, as established by the governor, have a sort of a leadership team that includes the leaders from all the counties in the region. We're on the phone every day, in fact, every day at 3 o'clock, talking with state officials. And I assure you that many times those conversations are heated, sometimes adversarial, many times cooperative. But at the end of the day, we as county leaders are trying to get information so that we can share it with you. And we're also advocating for our communities. And as we said a week ago, we felt that the region was prepared to take this first incremental step. We're grateful that we're now moving in that direction, and I think that's critically important for all of us. So if you're on the telephone and you have a question, dial 0. We'll try to get you in. If you have a question and you're following us on Facebook, simply type that question in the comment below the live feed, and we'll try to get to as many questions as possible. Now, I do want to say, and you're going to hear all of us say this, listen, it is critically important that we remain vigilant as it relates to our health. Some of the basic steps, right? The personal hygiene, and as businesses or employers, we're going to have to be engaged in a little more aggressive disinfecting in our establishments. It's also important that we wear face covering, and I know the ongoing debate, and I want to say this very much out loud. It is not fair to say to somebody who is taking the step of wearing a face covering that they're doing something wrong. And for those of you who choose not to wear face covering, it is also fair for others to say, could you at least engage in that physical distancing so that at the very least for the time being we're not transmitting the disease. I'll say this, and you know why. I certainly know the horrific toll that this disease can have on a person. It affected me and my family. It is not a political statement to wear or not wear a mask. It is certainly your choice, but we're going to encourage you to continue to do that face covering so that we can be safe and that we can transition as aggressively as possible toward restarting full activities countywide and region-wide and statewide. But I also want to say this, as we remain vigilant in that regard, there is something else that we ought to be equally vigilant about. Small businesses make up an enormous number of jobs in our community. In fact, most new jobs are created by small business owners. And for many of those small businesses, they've been on the sidelines with great anxiety and stress. Many of them have been planning and preparing for this reopening and deploying new tools, making use of technology, perhaps working with their staff to be prepared. So it is critically important that we are vigilant in spending our money and our resources for those who have it and you can spend it in those local businesses. And so as we're trying to save lives and protect lives, we're also trying to help Main Street get back to life. And now more than ever, it's going to be critically important that if you have the ability to spend a few dollars, that you use those dollars in the powerful way of supporting a small business and make that conscious effort. Just as sometimes now you're leaving the house and thinking, oh gosh, I better get that mask. If you have the choice and you have the resources, spend your money in a local business, because those local businesses will spend their money locally, and it is very, very important. It's more than just a cliche or sort of a throwaway tagline. It is critically important that we help these small businesses get back on their feet. And today, restaurants obviously are able to operate curbside delivery, etc. As we said, construction projects underway. If you've been thinking about finally making some repairs on the porch and you can afford to do it, call one of your local contractors to get them to work if you can afford to do that. And I respect the fact that there are a lot of people still out of work and you won't be able to make that choice. If you're going out to buy a product and you think you can get it on Main Street or one of your small businesses, please do that. And you can call ahead. They can meet you curbside. You can go in store to pick it up. And so for those people who wonder, and kind of laugh out loud, well, how will I buy shoes or a shirt? You can still call ahead. You can say, do you have those Nikes I've up, or whatever shoes you wear, at the store in size 11? And they say yes. You can meet that employer right inside. You can pick up the shoes. You can even try them on and then take them off with you as you go. So do try to support these small businesses, these local businesses. They're trying to be as creative as possible to meet the challenge, and I promise we're going to continue to move forward. We're going to go to Anna. Anna is on the line, and she had a question regarding retail, I think regarding the malls. Anna, are you there?
Yeah.
Go right ahead. Jump right
Hello?
in. Yes, you're with us. Go ahead.
Yeah, I just wanted to know, when will the Petition Galleria, like the stores officially, I work at the mall, and wanted to know exactly when will it all open?
Sure. So when does the Galleria open? Ron Hicks, you're on the call with us. I'm going to, since we have you and Dr. Wything with us, the retail stores at the mall can function now. They can do curbside or in-store pickup if they have exterior access. Is that correct? And then what do we think is the timeline for the malls? What phase do we think those fall in, Ron?
That's correct. They can, with exterior access, do curbside pickup or do delivery. And also, I would say that interior mall stores are probably going to be permitted to use the mall entrances for the same. It's something we're working with the state right now. In terms of letting people inside the space, at this moment, there are restrictions on anything over 100,000 square feet of space. So we are closely working with the state to help get those spaces open. But we're looking probably at phase 3 or 4, depending on the size of the space.
Okay. Thanks, Ron. So if you follow along, what the governor has said is that each of these phases are basically, the rule of thumb, and those are his words, is 2 weeks between the phases. However, that is not what we expect. We do expect that they, assuming the numbers stay flat or flatten, the governor has said that less than 2 weeks between those phases may be achievable. So again, worst cases, we're in phase 1 for 2 weeks, phase 2 for 2 weeks, phase 3 for 2 weeks. You can start to do the timeline. The expectation, however, is they'll accelerate a bit based on being able to have achieved the mission. The mission was slow down the rate of transmission and reduce the number of hospitalizations. Maria, I think, is on the line. Maria, we're going to go to you with a question regarding contact tracers, and then I'm going to ask Dr. Wything to talk a little bit about that. But go ahead. Maria?
Hello?
Yes, go right ahead.
Hi, yeah, I have concerns about the contact tracers. Just exactly what will they be doing? Will they invade our homes? What is their job?
They will not invade your home. I promise you that, and I don't mean
Okay.
yeah. So Dr. Wythian is going to jump in. Contact tracers have been employed and deployed by public health officials since the days of polio. And so for decades, we've relied on people to assist in identifying the transmission of an infectious disease. Dr. Wythian, do you want to join us and talk a little bit about what a contact tracer does generically, and then what should people expect in this case? So we're not invading your home. You're not being forced out of your home. In fact, you don't even have to answer your phone, although we would like you to. But go ahead.
The state and in this country, there are a number of reportable diseases that all health departments have to investigate. So whether it's a case of measles or a case of anthrax, the public health department, when we know of a lab result, tries to make contact with that index case, because some of these communicable diseases can be transmitted to others. So what we want to know is from that index case is what type of activities have they engaged in, where they've been, and what type of social contact they've had. And so this applies to COVID-19 also, because we know that COVID is transmitted from person to person with close physical proximity and also for prolonged periods of time. So what we would do is contact them either through email or by phone. We try to get information in terms of their activity. We make sure that individual is on home quarantine, so they will not continue to expose others if they're symptomatic. And then we try to find all those individuals that were potentially exposed so that we could reach out to them and make sure they take precautions such as self-isolation at home. So if they, forbid, come down with symptoms, they're not actively transmitting the virus.
So I would offer that we were under, well, first I'll be very candid. The initial expectation was that the county would need about 90 to 95 contact tracers. That number expanded based on the number of cases that we and other counties had to respond to. So thanks to the staff at the Department of Behavioral and Community Health and all of you, we were able to expand our team to include hundreds of volunteers. So in fact, nearly 500 volunteers now participating in one way or another, with some 300 trained as contact tracers. Again, we get informed of a positive case. We call, we say, who have you come into contact with? Do you know who they are? Do you have contact information? We then contact those individuals and provide them basic understanding of what they may have been exposed to and what precautions they can take, including perhaps taking a test, as Dr. Wythian said, self-quarantine if that makes sense. But there's not, I mean, I assure you in this county, our experience, and we've been doing this for years, there's not an invasion of your privacy. It is simply a call with information. And again, there's no, we give you advice and we give you guidance in the hopes that we can help you to make a smart choice as to how to take your next steps so we slow the transmission of the disease. I hope that is helpful. I want to jump through a number of questions that we received over Facebook. And Ron, you're going to take this one. Jen is asking about association, not municipal or special district libraries, but association libraries. And I think we did finally get clarification today. Ron Hicks, do you want to answer that one?
We've actually been getting confirmation several times as it relates to libraries. And if I can specifically address your library, I can do it directly if you want to provide the name of it. But we have been told by the state in our control room meetings on several occasions that all libraries that receive public funds are permitted to do curbside pickup and drop off. Most of the guidance that's in the state's on the state's database and under these codes that they've given each business says that that those are restricted to government-operated or special districts. But the control room and the people from the state and governor's office have said that libraries that receive public funds can do this activity, pick up and drop off. And I'm happy to follow up with you directly if you
we'll
try contact information.
Yeah, we'll try to connect. But any library that receives any public dollars, as has been instructed to us during our calls with the state officials, can function, can be open for curbside delivery, and if you choose, with restriction, can allow someone inside. That's correct, Ron?
That's our understanding.
Yeah. Okay. No, I appreciate that. Hey, Dr. Wythian, Kim asked us if the county department does contact tracing for other communicable diseases. I think I said that generally, but what other diseases would we be doing contact tracing? I mean, this, as I've said, it goes back for us. I mean, certainly as a society to polio days, but certainly was very valuable and important during the onset and the early stages of HIV/AIDS. What other infectious disease or communicable diseases would we use a contact tracer, and have we used contact tracers for?
Oh, absolutely. That's a great question. Mark, we currently monitor for the presence of more than 82 reportable diseases within New York State. So that ranges from all the way from anthrax, polio, measles, to sexually transmitted diseases like syphilis. And so whenever we get cases, we are mandated by the state not only to investigate, but also gather information and report that to the state.
And let me ask, if we were aware of, let's say, a particularly strong strain of the normal flu, the common flu, that maybe was in a housing complex or in a school, would that be something that we might have to engage in order to identify who might be infected? If there was a particular reason, wouldn't we also engage, even with the common flu, if we felt it had a public health risk associated with it?
Absolutely. That's a wonderful point. Although flu is seasonal and it's not a reportable disease, if we find the common flu is in a long-term care facility or in a vulnerable population and there's a cluster, we want to be able to intervene very quickly and make sure that facility or agency takes the proper precautions to make sure that it does not continue to be transmitted in that environment and people are protected. So that's a great question.
Terrific. Thank you for that. So we'll run through a few more, and then I'm going to jump to a phone call. Barbara asked about summer camps. The short answer is Dutchess County is alerting all of those municipal and private summer camps that receive health department permits from us that they should apply with safety plans. We believe that would be safe and appropriate to open in sort of concert with Phase 4, which is basically early July. But the state of New York has yet to direct whether or not they're going to permit them. We believe that one, there are two important needs, or two important things to address. One, that the camps can be operated safely with appropriate safety plans. We believe that from a public health perspective. And secondly, we know from an economic and sort of social perspective, having those opportunities is important. So we think in order to support families, you're going to need some of those activities during the summer. We recognize certainly that vulnerable populations and individuals who might go home to a senior, would want to be very respectful of that and may not want to participate in a summer camp activity. But again, we think that it's important structurally, economically, socially, and that we could manage that from a public health perspective. That said, it really is up to the applicant as to whether or not they want to engage in offering summer camp, and we're still waiting on the state of New York to make that decision. Nate is asking about schools reopening in September. I think the short answer is I believe that schools will reopen in September, but I suppose, and we expect that you'll see some precautions and safety planning that may make it slightly different. But as I've said before, there needs to be an opportunity for our kids to get back into a classroom to have that interaction with a teacher. Again, vulnerable populations, safety planning, but I certainly personally don't see that we wouldn't reopen and reactivate schools this coming fall. Kathy is asking, why haven't all nursing home residents been tested yet? And Kathy, I have an update for you. 12 of 13 we'll have completed testing at 12 of 13 nursing homes by the end of this week. It's taken multiple weeks. We have 13 total nursing homes in Dutchess County with hundreds upon hundreds of residents. As you likely know, or maybe if you followed along, we requested tests from the state that they reacted. They got us. I give them credit. They responded and agreed to bring us those testing kits. It just took a little bit of time. And then the state lab at Wadsworth had informed counties that they were just being overwhelmed by the number of tests and asked us to stop. Thankfully, the state stepped in and made clear that that's not an option. So we got right back to work, and our nursing home work group has been working tirelessly. I want to, for your sake, acknowledge Kathy Tetmeyer, Mario Gonzalez, and Ann Saylor, and a number of staff throughout the departments who've been working directly with nursing homes, and I want to acknowledge our nursing homes. Today we updated the community and on testing. As I said, by the end of this week, we'll have completed 12 of 13 nursing homes, and so far the results are promising. We're not seeing a large number of asymptomatic patients or residents who are testing positive. If I remember correctly, 8 in one particular location, and several others had no positive tests. And if you go to duchessny.gov now, that information is available, and I'm sure it'll be reported out. So very positive results, and we're very grateful to the nursing home staff who've been doing an amazing amount of work and job trying to keep their customers, their residents safe and healthy. So we'll have all 13 completed. We'll have 12 of 13 completed this week, and we'll get you updated on that. Lori is asking when we expect to start phase 2. As I mentioned, the governor has suggested worst case 2 weeks between phases, but if the numbers stay flat, we expect, and he has said that could accelerate. The incremental change between pre-phase 1 to phase 1 was nominal. Phase 1 to phase 2 is nominal as well. So I would encourage and think that we could get to phase 2 in less than 14 days. Phase 3, which is much more the social businesses, may take that full 2 weeks. But the goal here is to be as quick as is responsible. And that's where we are. Are we going back into quarantine when the flu season begins? Ryan, I'm going to assume that there was no sarcasm attached in that question. And just to say to you, no, we're not. Flu season, the goal here, of course, is to slow the rate of transmission for this disease. We don't have a vaccine for you to choose to take. We don't have a therapy to deal with it. And I would acknowledge nearly 90,000 Americans is that correct? Died to the disease nationwide, and so it's 100,000. Excuse me, 100,000. So I just offer to you that this is a real disease with real challenges, and the goal here is to slow the transmission, not overwhelm the hospitals, and assuming we can maintain that, we continue to move forward in the hopes that there are therapies and vaccines that will become available for the public to take advantage of. Lois is asking when bus service outside the city of Poughkeepsie will start up again. June 6th is our plan. Monday, June 6th, you should see bus service reactivated. Is that correct? Saturday, June 6th. There's another person in this room, and he's telling me Saturday, June 6th, so I apologize. Saturday, June 6th for buses, public transit, and it is right here on my schedule, on my notes. We return to a full schedule on Saturday, June 6th, and you should look for that. There'll be some safety steps that you'll want to take. Drivers, of course, will have face coverings and gloves. Riders will be asked to wear face covering. However, there will also be face coverings available as you enter for riders that need them. I will offer you in the early stages, we're going to continue to maintain no fare, so there'll be no fare charged in the onset of reactivating the bus service. That will fares will get reinstated at some point, but for the short term, we're going to keep that from happening as we transition back to full service. Miss Kelly is asking us about selling her house. Ms. Kelly, are you on the phone? Ms. Kelly, are you? Yeah, go ahead.
If you have your house on the market and you got a potential buyer, is it permissible to sell?
It is permissible to sell. Ron Hicks, do you want to talk a little bit about what realtors can and can't do at this point? But yes, you can sell.
they're doing most of their work virtual, and you absolutely can go through that process, and you can actually do I've heard of attorneys doing Zoom closings. But and I know somebody else has asked about having people show your house. While we haven't heard from the governor hasn't said whether or not realtors can go back to showing houses and walking around with prospective buyers. You as a homeowner, or you can designate somebody to walk in with them to make sure that everything is safe and nothing's stolen, or you feel someone comfortable that you're comfortable with. But social distancing must be maintained. You have to have them wear masks, and it's probably a good idea to make sure you wipe down anything that was touched. But so it can resume somewhat normal, but it's just not, you can't turn it over entirely to a broker like you did in the past at this time.
Fair enough. Thanks for that. Dr. V, we're going to go to a question from Jackie, who's asking about a vaccine. What do you know about the current status of preparing and developing a vaccine, whether or not they've moved to, what trial phase have they moved to, and what should people be aware of? I think that it's traditional and conventional to think that we would not have access to a real vaccine for, as I understand, ordinarily from 12 to 24 months. However, there seems to be some promising activity. I don't know if you want to talk a little bit about that.
Sure. So the reason why we have a vaccine every year for the flu is that we sort of have done a lot of the work for seasonal flu. So if you were developing a new vaccine, typically a new vaccine may take in the order of sometimes 4 to 6 years. And so there are multiple manufacturers who are working around the clock, and many of them are in phase 1 trials. Phase 1 trials are limited trials that look at things like whether the vaccine will provoke an immune response or whether there's a serious safety issues. And then they move on to phase 2 and phase 3, where you look at larger populations. But all these phases have to be done mainly to make sure, number one, you have an efficacious vaccine, number two, it's safe, and number three, that it does what it's intended to do. So even though they may be speeding the process, we're still looking at well over 12 to 15 months before we can arrive at a vaccine.
We're going to stick with you for a moment. Gina's asking about, and we recognize this, about those who can't wear a face covering due to asthma or some underlying condition. First and foremost, certainly if you have some medical reason that you can't wear a face covering, you shouldn't wear a face covering, and no one is going to expect that you would. However, if you do also have some underlying ailment, you will want to engage in the physical distancing and kind of limit that sort of social interaction. There was, let's acknowledge up front, there was advice early on not to wear a face covering. I will be candid. I think, Dr. V, you were among those who believed that based on the CDC standards that wearing a face covering wasn't the most effective, but you also always offered this caveat, which is if you can't maintain social distancing, a face covering is useful. Can you talk a little bit about what I'll say is the debate over a face covering, why we think it's still important and valuable, and what do you do if you can't wear one?
That's a great question. You know what? In the 2 months since March, we've discovered a lot of things about this virus. If you look at what is the major mode that this virus is transmitted, it's typically person to person, individuals who are packed into an area and are in a protracted period of time. So we know that, again, social distancing and face coverings are effective in preventing viruses that are either airborne or transmitted by respiratory droplets. So if you look at our metrics, all the containment and mitigation steps
especially with regard to social distancing and face covering, has had an impact. So again, while we go back to some of the activities we're used to doing, I think it's important that when we have these social interactions that bring us face to face with other individuals, that again, if at all possible, face covering, I believe, is critical.
I'm going to jump to a couple other questions. I know that Mary had a question regarding summer sports leagues. If you have a question, you're on the phone, dial 0. Mary, go right ahead.
Hello?
Hello, go right ahead.
Yes, my question was actually already answered. It was about the summer camps and summer leagues. I wondered if any of that was going to be able to take place this summer.
Fair enough. Why don't I don't know that I answered specifically about the summer like sports leagues, so I will offer that again. In Dutchess County, we think that it would be safe in what's referred to as Phase 4, which are more of those recreational and event activities. That would be in July. We think it's safe to have intra-county sports activities. So if you're in a men's league in LaGrange and you're only playing teams in Wappinger, we think that's safe, and we think that can be managed in the July timetable, that Phase 4 stage. However, the state has said that they still are going to make that determination, so it is going to be up at the end of the day to the state to determine whether or not they're going to outwardly permit them. I would tell you that if you're in a travel league, it is not likely that would occur this summer, meaning if you're traveling and playing teams from, I'll just say, perhaps Westchester, Long Island, Rockland County, south into New York City, it just doesn't make sense that would be something that would be encouraged early on, and certainly, this summer, and certainly not something that would include an audience or fans or some large interaction. So again, I think within county, you will see some of those leagues pick up in the summer months, but I would not expect to see any of the travel leagues functioning this summer. Again, the goal here is to keep the hospitalizations down. We were very fortunate, and we've got a great hospital system. New Vance and the Westchester Medical Network both prepared well. On our worst day, we had as many as 150 individuals hospitalized in Dutchess County. Now, that's out of potential 500 beds, but understand that's 500 beds in facilities that were closed to other activities, except for some very, very specific services. Our hospitals, most hospitals, are not made to have 100 people with an infectious disease in them unless we're able to quarantine or at least segment off wings of the hospital. So our hospitals were prepared for Phase 1. They supported that next step. But I will tell you that those in our hospital community today believe that we've got to be careful because they are not capable of taking on 100 people over the course of 2 weeks without shutting aspects down, and that paralyzes the healthcare system, and that's what we're trying to address. A lot of people asking about DMVs, haircuts, tattoos, salons, massage, et cetera, et cetera, et cetera. Let's start with DMV. First, if you have a Department of Motor Vehicles question or a clerk's office question, Dutchess County's clerk, Brad Kendall, oversees that department, that office. He's the elected county clerk, Brad Kendall. He's been staffing that office. There are people there. However, the DMV is a state office. It's operated by us, but it's a state office, and the governor is yet to say when the DMVs would reopen. So if you have a question, you should dial for DMV-related questions 486-2384. 486-2384. They'll try to advise you. Now, what we do know is, I'm going to ask Ron Hicks to jump in, although I do think I know the answer. Salons, hairdressers, massage therapists, sort of those activities, we believe are now deemed Phase 2, that the governor said on Friday they're Phase 2. Is that correct, Ron? And what should people expect?
That's what we believe, but they haven't specifically prescribed it for Phase 2 yet. We're pretty sure it's all those licensed with that individual one-on-one contact, and they have not yet put down the guidance for Phase 2. But we do think that if you look at the current retail phase guidance that's on there, the guidelines, the affirmation, and the template that's required, it'll be probably in line with what will be required. And what we're anticipating is capacity reductions in each space. So that's the best we could offer at the moment.
Okay, and the governor did say out loud on Friday that he felt that would be deemed phase 2. But like all things, as Ron mentions, and we'll remind you, sometimes we see the public comment, but the website and the state guidance isn't to follow for some time. But we're hopeful, and we expect that would be when those types of businesses could reopen with those safety plans. Ron, while we have you, Jenny is asking if she goes back to work. So if she's required to go back to work, things open, and she then is quarantined for 2 weeks. If she contracts COVID, how does that work? Does she collect unemployment? Is the employer required to offer her benefit time? How does that work under the current structure? Do you know that answer?
I don't, because I actually don't know where she specifically works and if she works for a bargaining unit or not. But if she sends me an email, we'll get you an answer.
Okay, so visit duchessny.gov, or you can email Ron at thinkduchess.com. I believe that there are protocol. Well, first, if you're in a collective bargaining unit, there's some protocol. But there was some protection offered by the governor for those who contract COVID and have to be quarantined. And then unemployment. I don't think that you would qualify for unemployment in that scenario. I think there's an emergency protection, but Ron can give you that additional information. Susan is on the line. If you have a question, dial 0. Susan is on the line asking about religious services. Susan, do you want to ask that question?
Yes. One of a concern that I have is that for me, my faith life is essential, and I'm just wondering, when is it realistic to expect that I can get back to Mass?
So and I agree that it wasn't a major step forward, but the state now permits as many as 10 individuals to attend a faith service. That, of course, is nominal for most larger parishes, certainly synagogues and other houses of worship. Now they can also now conduct vehicle-based services, and that can occur at a drive-in theater or in their parking lots, and that's permitted. And I encourage faith leaders to do that. I think at the very least it's an important next step. Based on what we've heard, there's sort of two schools of thought. One, that this would be more likely phase 4, larger social events, recreation events, with limited capacity. So phase 4 would be July. However, I think likely there's both litigation and a lot of pressure to get houses of worship open to some capacity sooner. I will say personally, and it's not based on my understanding. I think there's public health reasons why you'd want to limit capacity, but I do think that houses of worship provide an essential service. Not only a constitutionally protected one, but an essential service for so many, that there ought to be some accommodation more than just simply 10 people. That based on size and capacity, I think that there's certain questions that could be answered. I hope that the governor and the state take that action and move forward. But again, first school of thought is phase 4. But the hope is, and the expectation ought to be, that they move more quickly with restrictions, with safety planning, with precautions, but still to accommodate no matter what your religious faith is. Now, I'm a churchgoer, and all I can offer to you is that in the meantime, I think you all know, exercise your faith as you can, knowing that hopefully very soon we'll be back in our houses of worship with our faith leaders, regardless of what faith you're in. So that's what we know so far. Yard sales. Stephanie was asking about yard sales, barn sales reopening. We also think that that's phase 4. Larger social events, social activities coming and going. No real control over capacity or what have you. So we think that that's phase 4, which would be early to mid July, based on what the schedule seems to be. When can restaurants open at full capacity? Ron, do you want to talk a little bit about what we know, what we know or should expect for restaurants at this point?
Yeah, right now restaurants can do takeout and delivery only, and we are expecting that as we move into phase 3, that they'll be permitting some capacity inside. We just don't know what that amount is going to be yet. The county executive has been working proactively with our municipal leaders, asking the state to waive certain zoning requirements and give us opportunities to do more outside dining on a larger footprint than they would otherwise be permitted, and to allow them to take that food or alcohol or drink into public spaces using parking lots, using parking spaces on streets, or just the general open space within a locality. So we're proactively working on that, and as soon as that comes, that permission is not likely to come into a phase. We're hoping for them to give us that permission to do at any time. But internally, we see that in phase 3, and it will be in limited capacity, and again, it will be based on the numbers.
Thanks, Ron.
Meaning how we're doing in terms of COVID.
Right. Thanks for that. Peggy's asking how to prepare for absentee ballots on Election Day. Let me go through what we know on the next set of elections. First and foremost, the most current is a school district vote. So for a school budget or for a school board candidate, that is entirely absentee ballot, and that is administered by your school district. So some school districts have used Dutchess County to print those ballots. You would have been mailed or will have been mailed a ballot. You get that ballot, you vote, and you cast it by mailing it back in. We did get a question today. Someone had asked, they had actually received 2 ballots at their home. The good news is that you could fill both of them out, but when it gets to the school district, they're only going to pick one, so likely the first one, meaning that only one vote is registered per voter. If by chance your household or particular residence may have had multiple voters, there may have been multiple ballots sent. But that said, only one per voter gets registered, and that's the school district. That's automatic absentee. The next set of elections are June the 23rd, Tuesday, June 23rd. That is for the Democratic presidential primary, along with a number of local primaries. You would have and should have received an application to vote absentee. If you have not, please reach out to the Dutchess County Board of Elections. Commissioners Eric Haight and Beth Soto have been working with their staff to get ballot applications out. So you should have received an absentee ballot application. You can choose to complete that application, and then a ballot will be sent to you, and you can vote via absentee ballot, or you can choose to go in person to vote, keeping in mind that there will be fewer poll sites, and that there, of course, will be restrictions on numbers of people getting into a building at a particular time. So be prepared if you show up to the polls and you want to vote in person, and that is your right, that it'll take probably a little bit longer than maybe you're used to. But whatever is your choice, you'll get an absentee ballot application. You can choose to vote absentee, or you can choose to vote in person. And then the expectation for the November elections is likely something similar, although not yet defined, that either the governor still will have to make an order to decide if they're going to be by absentee application or in person. But I would expect for the November elections that you might end up looking at something of what we've experienced already, which is an absentee ballot application mailed to you, and then you choose to vote in person or by absentee. But that is yet to be decided for the November elections. So when Dr. V, when someone is told that they should self-isolate, well, first let's do this. If so someone tests positive, we know they came into, they're experiencing symptoms, they come into contact with someone, maybe it's a family friend or what have you. We inform them that individual that they came into contact with someone who tests positive. Are they required then that contact? Is that contact required to self-isolate? Are we encouraging voluntary isolation? And then the question is, in that situation, how do we make sure that they are self-isolating?
Yeah, that's a good question. Currently, individuals who are identified symptomatic in cases, there's a commissioner's orders that mandates that they self-quarantine. Now, the contacts are not symptomatic, okay? And they are not positive yet, but they have a 14-day window from the time of exposure to possibly develop symptoms. And so we also may mandate that they self-isolate at home. And we would, when we are in contact with them, we send an email order saying they have to self-isolate at home. So yes, we expect that they will isolate at home, but we don't have the capacity to sort of track and make sure they are at home, especially when we're dealing with over 1,000 individuals we may be monitoring. So we use technology, we use computer programs, we use phone to sort of monitor. But again, I will tell you that we are relying on people's good conscience to make sure that not only are they protecting themselves, but they're protecting their community by self-isolating at home when they indeed have been exposed.
Susan was asking about non-municipal, like apartment complex pools open again. That is a decision the governor is yet to make. Again, Dutchess County is prepared to permit those activities this summer. We have sort of established the first week of July as when we think it would be logical to permit access to sort of those community pools with safety planning, but the state has yet to permit that. In the meantime, we are asking those organizations to apply for their permits, and we'll consider them with a safety plan in effect. Kathy, any chance the Renegades are going to play this summer? There is no one in Dutchess County who wants the Renegades to play this summer more than I do. Maybe one or two, young kids, but I want them to play. That is still up in the air. It is possible that in Phase 4 you could see baseball activities, likely with limited capacity at the stadium. That is as much a decision for the state as it is for minor and Major League Baseball as it is for us. I will tell you that if Major League Baseball thinks that they can make it work and the state says they can make it work, we'll make it work here in Dutchess County. But we're not able to say yet. We're hopeful that that does happen. When will zoos like the Trevor Zoo be open? Ron, you can jump in. These sort of outdoor venues we think are Phase 4, even with light capacity. The Trevor Zoo, do we think that's Phase 4?
Yeah, we actually have Trevor Zoo in as a test case because of the low risk environment. It's very similar to walking through a park, and there are a couple things that they would have to do to set it up. But we have that into ESD, Empire State Development, who makes the determinations as a test case right now and just waiting an answer.
Okay, thank you. If you have a question and you're on the phone, dial 0. Why don't we go to Susan? Susan had a question regarding the right to enforce the use of masks, which I will offer to you is a bit controversial. I don't want us to go Staten Island on people, and I say that respectful of my friends at Staten Island. There's a video of a person being shamed. But that said, Susan, are you on the line?
Yes, I am.
Why don't you ask your question? Go right ahead.
Well, I applaud the food stores for having the signs up you're supposed to wear a mask and having the directional signals of, which to keep the aisles one way and the spacing, the 6-foot spacing for checkout. It's all well and good, but the number of people who don't seem to think it applies to them is larger than it should be. And I have occasionally stopped someone and politely said, "Excuse me, you're going the wrong way. This aisle goes the other way." And I've had people say to me, "Oh, thank you very much." And then they continue straight on. It's like, yeah, okay. Why did I bother? I'm not trying to deny the food store revenue. But is there anything that can be done short of, calling out the police?
Yeah, well, short of calling out the police is I think the indicator there. Let me first say that when it comes to face coverings, keep in mind that some people do in fact have medical conditions that preclude them from wearing them. And so I know you're talking about sort of all of the best practices that businesses are using, and we've been very grateful that our businesses are using them. But do keep in mind, and we've said this many times, the use of a mask is important if you can't social or physically distance. But again, if you have some medical reason, and it's really not our right to know, then of course wearing one could cause you an issue, could compromise your health. And there are those, by the way, with not easily identified intellectual or physical disabilities that could preclude them from using a face covering. But your point is a good one. Ron, could you talk a little bit about how we've not been heavy-handed about enforcement because we've gotten a lot of collaborative response. However, we recognize that in some cases people are just not going to follow the guidance. But do you want to talk a little bit about how we've attempted to work with our businesses on that?
Yeah, the counties are actually mandated by the state to carry out enforcement. And I'm one of the task force members. And the majority of the complaints that we do get are people who are not wearing a mask or not social distancing. And just one thing I should mention is that and I think the county executive alluded to it in the beginning or said it outright, there are some people who might be on a trail or might be outside a store or anywhere in public, and they are together and they're not wearing a mask. They're probably living together, they're traveling there together, and so they exist that way together. And so we have to make sure we don't make too many assumptions. I myself have made the mistake because the markings on the floor have gotten a little dirty, and I caught myself going the wrong way and just quickly got out of that. But what we usually do is we call the store, and we've built a relationship with most of them to just let them know that we've gotten an official complaint, and they keep on top of it. We know that it's difficult to enforce, and we have seen across the country where people have challenged someone not wearing a mask, and it's resulted in physical harm, and in one case, death. So we want to make sure we don't put anyone in harm's way. But the county executive did a very good job of putting out best practices, putting out posters that we developed, and then encouraging others to implement these best practices that you're seeing now. And I guess my advice to you, if you see somebody coming the wrong way or if they aren't wearing a mask, is to just keep your distance and leave that aisle. That's the best thing that we could do at the moment because we don't know if that person has a medical condition, and you're actually prohibited from inquiring about that medical condition or asking for proof under the governor's order. So we're doing our best, and where we've had egregious complaints of large gatherings of people inside, we typically defer to our local municipal leaders who will send a code enforcement officer out to check on it and educate. There's been very few occasions where we've had to enlist law enforcement. It's only in the event that it could result in some altercation. But we found most of our businesses and individuals to be compliant, and we ask them for their understanding as opposed to the shaming that the county executive mentioned before.
Yeah, I want to reinforce that. And first, Susan, I don't think you wasted your time being polite and just mentioning to the person the markings on the ground because the next time they come in, they may be a little bit more aware of it. And quite frankly, sometimes that's the way we react, which is perhaps we're a little bit embarrassed that we weren't following the guidance, and we might make up for it when you're not watching. And I think that is entirely normal. I also think it's entirely appropriate for neighbors to be considerate to other neighbors. And so I've said this, and I really do want to enforce this, and I kind of half kidded about it when Susan asked the question. Listen, first of all, the exchange of ideas, the difference of ideas, it's our responsibility to make choices in life. Some people want to choose not to do certain things. That's their choice. Some people choose to do those certain things. That's their choice. When it comes to following the guidance, we encourage you to do that. There are going to be those who choose not to. Being polite about it and asking them perhaps to pay attention to it is appropriate. And it is equally appropriate to respect someone who chooses to follow that guidance. They're not making a political statement either way. Some may be. But at the end of the day, the goal here is to be considerate of one another. And shaming people into wearing or not wearing, walking up one aisle or down the other aisle isn't appropriate. It is not appropriate. And you're not going to hear me, and I certainly am not going to encourage other politicians to sort of bully you into thinking you should do something that you don't want to do. But at the end of the day, by considering one another, by being considerate of one another, we are going to be successful in slowing the transmission, protecting lives, and getting back to life. And so I just, again, don't think, Susan, you wasted a moment in mentioning that. I can tell you that I catch myself every so often, and I, of all people, should be going the right way down the aisle. And it's important. But in the same respect, if someone says that to you, please be respectful of them. You don't need to, there doesn't need to be a harsh remark back, a simple thank you, and then go about your business. But I do think it's very, very important that we be judged by how we treat one another. And if we don't share the same belief and we don't have the same ideology, or we want to make a particular statement, do it in a way that's respectful of the right of that other individual to have a different opinion. And that's what we ask. And to the extent we can get cooperation, we do. Very few times have we had to really become all that intrusive. But that's what we're looking for, and that's what we're asking for. And I think it's very, very valuable. And I think at the end of the day, again, there sometimes isn't always the right answer, but rather choices. And those choices that we make are meant to get to the best outcome. And so I just would encourage you to be respectful of one another and as best we can. I think in this county, if we can show people that we're respectful of our differences, we could be an example for others. And I just think it's so very, very important that we do that. Ann had a question on the line regarding antibodies. Ann, do you want to ask that question?
Yes, in the Mid-Hudson Valley or in Dutchess County, is there any facility that is currently administering convalescent plasma with antibodies to cure people who have COVID-19? This is a technique that has been known and used for over 100 years, going back to the Spanish flu of 1918. Why is it not being used more widely?
Well, just like the Spanish flu at the time, there may have been treatments that people felt were addressing the illness, but there was not an identified cure. Dr. V, do you want to talk a little bit about what we do or don't know? And then I have a couple questions. I'll do very quick, rapid questions, which require rapid answers for folks who have asked them. But you want to talk a little bit about what do we know about treatments and vaccinations at this point?
Sure. There are numerous trials that are currently going on, and the trials include convalescent plasma. Early indications show that it may be effective. So I could not speak with great certainty whether that's also being conducted within the Hudson Valley area, but I know it's being conducted in New York City. So while it's been used effectively, it may not be effective for all pathogens. So that's why it's currently used in an investigational manner.
You can correct me if I'm wrong. In 1918, we were maybe a little, how shall I say, less rigid in trying things out on people than maybe we are today. Is that fair from a medical perspective?
Certainly, that is certainly true.
Fair enough. Felicia is asking about the potential for a second wave in the fall. Do you want to talk a little bit about, one, what do we know about the weather conditions affecting the transmission? And then two, what we be prepared for come fall, perhaps?
So those are all speculative. The reason why we speculate that there may be a second wave is we've seen with other viral illnesses, especially flu and novel flu, that again, it can be multimodal, meaning it may have multiple peaks and may have multiple waves. So when you look at 1917, 1918, for the Spanish flu, it presented in multiple waves. When you look at 1957 and 1968, it sort of presented that way also. So again, we're not sure how this will evolve, but we should be prepared and make all the necessary preparation to be able to manage if indeed we get a second wave.
Thank you for that. Question Laura had, won't cases go up since we've ramped up testing? We'll always, as long as we're testing, we're likely to have positive cases. When Laura uses the term ramped up, but we've been pretty steady in our testing, Dr. V. Are we seeing the transmission rate slow or grow with the size, the number of tests we're conducting?
Actually, again, you mentioned this earlier, Mark, about the metrics that allowed us to open up the state. And one of the metrics is new cases. And so we are testing more daily than ever before. And so where I think, we had a period of time we were doing 1,000 tests almost a day. But what we're seeing is the number of positives are dropping. So that is not indicative that there is no transmission, but what that is indicative of is the rates of transmission has come down significantly. And what you're seeing is the benefit of that. We're not seeing as many hospitalizations. We're not seeing as much utilization of ICU beds or ventilators. So all that are very good signs that although transmission is occurring, it is not occurring at a pace where it's overwhelming our healthcare system.
Thank you for that. Karen asked about if hospitalizations and deaths go up, will there be a pause to the next phase? Interestingly, first, that's the expectation, right? If we see a growth rate in hospitalizations in particular, and understand none of the benchmarks the state measures is simply new positive cases. It's new admissions to hospitals, it's hospitalizations, it's hospital-related deaths, and then, of course, those other metrics that we monitor on our own, the contact tracers and the diagnostic testing capacity. But yes, if hospitalizations rise, there is likely the need to slow down. The expectation, of course, is that we again always keep from seeing this rate of growth, this rapid rate of growth in hospitalization. That is the goal, and if it's not achieved, the expectation is things would slow down. Again, that's what we're all monitoring. And the hopes is by being vigilant, being smart about our choices, we can slow the rate of growth. Slow the rate of growth. And keep that those hospitalizations from growing. Linda asked about family court. We think courts are going to begin to open to some in-court procedures as early as the 7th or 8th of June. Does that seem right? The Monday after the 6th. So I guess that's the 8th. We think the courts haven't made final determination, but there will be some new court activity in early June. Ron, Cindy's asking what phase are dental offices in? Right now, any emergency service can happen at a dental office, but do we know yet what the state has decided is the sort of standard dental procedures? When would they occur?
They haven't been clear on that yet, but we believe it's phase 2, so we're waiting. I would recommend if you are with a dentist's office or you're a dentist, just keep in touch with the New York American Dental Association, their chapter. They're pushing out guidance so that you can be prepared. But if you're a customer, I would say reach out, because while emergencies are permitted, there are some things that are medically necessary that may not be considered emergency, but work can be done. But your traditional, cleanings and those maintenance visits and cosmetic are not permitted at this time. But
right.
We think it's phase 2 with professional services.
Yeah, okay, fair enough. Tanya was asking about any updates on graduations, high school graduations. The instruction is from the state at this point in time, and we don't expect it to change before graduations would occur. The state instruction, the governor's instruction is drive-in movie theaters can host graduations, schools can host graduations in their parking lots, or their vehicle-based graduations in their parking lots, or you can engage in a vehicle parade or convoy of sorts, a procession, vehicle procession for graduation. Those are the instructions. We've asked for some specifics. For instance, could a school schedule an opportunity for students to one at a time cross a stage? They take photographs to get their diploma. We're waiting on direction, although I will tell you that what I've advised school districts, at this point, is just as they've arranged for students to come in to collect their belongings. If they schedule by appointment students to come in, perhaps take a photograph, collect their diploma, that would be permissible, again, with the expectation that it's limited in capacity, just as it is now. You might schedule with your school to pick up your belongings, to clear out your locker, to get maybe it's the yearbook or the last bit of information from the end of the year. That is entirely up to the school district, but for graduations, those are the limitations that we're under. There are some that are hoping, perhaps if they hold out, maybe they wait till later in the summer, they can have a larger activity. But again, we don't expect that is going to be permitted, those sort of social gatherings permitted, till late into the cycle. And again, those are the instructions that we have as of this point. The county is working with our school districts to try to be as helpful as we can. I do want to be clear, all of this comes from the state order. We're communicating what we know that order to be, but our Department of Emergency Response and our Department of Behavioral and Community Health are working with school districts to develop their plans, and we want to support them to ensure that our high school graduates get the very best they can under some entirely unprecedented circumstances. Evan is asking where we can get free or low-cost antibody testing. Dr. V, do you know offhand access to antibody testing? I can rattle off some providers unless you can.
Mark, I think you have that list. But I will tell you that there are so many antibody tests that's available. A lot of those antibody tests, their performance characteristics have not been fully validated. So, the ability to indicate whether you're immune has not been fully established. Just because you develop IgG or IgM, which are immunoglobulins that your body makes to as a response to an infection, doesn't necessarily mean that you may not get sick in the future. So there is so much with regard to antibody testing that we have yet to know about. With that being said, commercial labs can easily do IgM and IgG testing. There are some facilities and organizations like Caremount that can do antibody testing. With regard to cost, I am not aware of that type of information.
DuchessNY.gov, you go to our COVID resources tab on the page. You'll be able to find direction to those that are providing antibody testing and diagnostic testing as well. And of course, if you reach out to us at DuchessNY.gov or you call our hotline, the county continues to maintain our hotline at area code 845-486-3555, 845-486-3555, and that hotline is available to you. As again, we've talked about this before. If you are also dealing with any particular mental health issue, stress, anxiety, we continue to maintain 24 hours a day, 7 days a week, our helpline, and you can call or text that helpline at 845-485-9700. And again, you may feel comfortable just texting, and those professionals are there. And it could be anything. You could be experiencing something that you know to be a true mental wellness concern, mental health concern, or it just may be that after a very long day and you've had your hands full with the kids, you need to decompress and you've got some serious questions. We're here to help, and you can reach out to our staff at the Department of Behavioral and Community Health through the helpline. They're there to help you. Why don't we go to Mary Ann? Mary Ann had a question on the phone regarding masks and gloves for workers, restaurant workers in particular. Mary Ann, are you there?
I am.
Go right ahead.
You.
You're welcome. Sorry to have you wait. Go ahead.
That's okay. No, I did take out food last evening for like the first time, and I was very dismayed to see the chefs in the restaurant not using gloves or masks. The girl at the front counter had a mask on, but nobody else did. And I approached the proprietor today with a phone call, and he said it's impossible to cook with gloves, and it's very hot to wear masks.
Well, I mean, both of those may well be true. Ron, do you want to, in a restaurant setting, certainly anyone who's interacting with the customer has to at least engage in social distancing, face shield or some face covering, and should likely have gloves on, although, again, we do know this. Listen, if you have gloves on and you engage in some activity and you don't change those gloves, they really provide you no particular health benefit. I know that I'm somewhat accurate because I can see Dr. V nodding his head in agreement. But Ron, do you want to talk? What should a customer expect in a restaurant setting regarding use of PPE?
Yeah, and I'm going to speak to the COVID situation and would have to defer to health on the regular rules. But our understanding is that those preparing the food, as the county executive just said, whether you have gloves on or it's your hands, it doesn't make a difference if you're not doing proper sanitation. But the masks are not required, or face coverings are not required for those that are cooking food, as long as there's social distancing. And then any interaction with the customer requires masks. I don't know that gloves are anything more than a best practice as it relates to COVID, at least outside a clinical environment, but I would defer to Dr. Viding if he has anything to add on that.
Why don't you talk, Dr. V? Listen, I'm of the belief that gloves are only useful under very specific circumstances, and in most cases, I would offer that many people don't use the gloves effectively. For instance, go to the grocery store, you're wearing a pair of gloves, you pick things up, and you check out, and then you touch your face. That's no different than not wearing the gloves. But do you want to talk a little bit about that?
Thank you, Mark. Mark, you and Ron hit upon some very important points, which is in terms of the best thing a chef could do is pay very good attention to the food prep and hand hygiene. So if food prep, if they're diligent with that and they're very judicious in terms of hand hygiene, I have no concerns with ordering from that establishment, because I don't think that is what's going to pose a risk to me. When people choose to use gloves, that's for a particular activity. You put it on because either it's protective. Once you're done with that particular activity, you should take it off and perform hand hygiene. If you go on to another activity, it defeats the purpose. So you could be taking on and putting off and taking on and putting off gloves constantly. But I think the right thing to do, especially in a restaurant setting, is pay very close attention to the food prep and hand hygiene.
I'm going to try to rapidly go through a few Facebook questions, and then we're going to get to Mike, who had a question regarding gyms. But first, let me get through as many of these. Maybe Marissa got married. Congratulations to you. Many blessings and continued happiness. She got married, and she wants to legally change her name at the DMV and Social Security. Social Security office is not a county office. But you should reach out by phone. If you want to reach out to the county clerk's office to get to some direction, and they'll be able to help you. That number is 845-486-2384, 486-2384, and they'll be able to give you some direction on how to address that. I do say to anyone, if you've done any legal activity that you need to have recorded in any office, save all the paperwork. Regardless of when you ultimately get there, save all the paperwork. And I know, obviously, that's very, very important for you. Alicia referenced that her husband passed away 5 weeks ago. First, you have our sympathies. Believe me, we share our condolences and prayers with you. And when do you think you can have a general service? The expectation is that would be in the phase 4 category, which is some of those larger social activities, middle to early part of July. I'm hopeful that you get to have that experience, and certainly friends and family can come together to celebrate your husband's life. And I'm so sorry for your loss. That is the expectation, that phase 4. A lot of questions regarding special needs preschool, OPWDD group homes, and special needs services for those with intellectual and developmental disabilities. Let me tell you that, again, I've communicated with the governor, and I'll say this out loud. I think that the state has been very slow inappropriately so, in providing the right support for those with disabilities. That there are good people working in the system, I don't question that, good, decent folks at OPWDD, countless direct care staff who are working tirelessly to help those with disabilities. But failure to meet the expectation that young people get special education during the summer in a way that is more than just virtual, because some students need to have that direct connection with their therapies, OT, PT, speech therapy, otherwise. Failure to meet that expectation isn't just wrong. I think it's criminal. I think it's a violation of their human and civil rights, and it needs to be addressed. Summer services, we believe, again, OT, PT, speech therapy services ought to be readily available. We believe that it's safe and can be conducted in a safe manner throughout the summer. However, the state hasn't provided clear direction on when those services would be permitted. If I were guessing based on the phases, we would think either phase 3 or phase 4. I think all of those things are important. I was asked, and Ron, you may want to reinforce this, but if I get this wrong, are businesses allowed to refuse service to someone with a disability who cannot wear a mask? I think the answer is absolutely not. Do you want to correct me?
I think I understand businesses can have the right to refuse service, but an individual with a disability or the situation you described, I think is actually protected and considered discriminatory.
Yeah, I think under the Americans with Disabilities Act, there needs to be a reasonable accommodation in all circumstances. And if you have a disability and aren't able, and that disability could be a medical condition that precludes you from wearing that kind of face covering, there needs to be accommodations. Now, could a business ask you to ring ahead or meet at the door? I suppose they could. Those are the kind of accommodations that are made already for those with disabilities under the ADA. But again, that service cannot be denied because of a pre-existing a pre-existing disability that is protected under the ADA. We have a few more minutes. I want to go to Mike on the line. Mike had a question regarding gyms. What phases do they fall in? Mike, go ahead.
Yes, thank you. I was wondering when gyms might reopen, and what about using masks, gloves, or social distancing at the gyms when they do reopen?
So we expect that gyms fall in the phase 4 category, which is that recreation, social, community event activities, those sorts of things. I would expect first, again, all of those businesses would have to have a safety plan, and I would expect that what you'd see is lesser capacity. Just as an example, right? I go to Mike Ortega. Mike Ortega likes when I say his business. I like all of you, All Sport, Golds, Planet Fitness, Social Fit, or Fit Social, and countless others who provide those services. But for instance, you're on those treadmills. You might have every other treadmill used as opposed to all of them all at once. You should expect lesser capacity, some of that distancing, and for certain activities you might expect to have a face covering, but some clearly you would not. Ron, do you want to add to that at all, or did I cover it?
I just wanted to say that we are working to try to get a test case through for a minimal operation of a gym, and we are currently trying to get personal trainers. And then outside exercise classes of no more than 10 permitted, like a CrossFit, for example, who might be able to do some instruction outdoors. These are things we're trying to work with the state right now to get permitted. I think it's important to understand, and Dr. V can elaborate on this, but this is a respiratory illness, and within gyms and closed spaces, if you're working out, there's more aerosols, and you have to be concerned about that. So that's why they're at phase 4, but we're looking to try to do things that involve outdoor activity or where there's larger spaces, indoor personal training, and again, working with the state, and we're kind of hoping that some personal training outdoor will happen in phase 2, but we have yet to see that.
Timeline for phase 4.
Oh, thank you. So if you assume the phases are 2 weeks between each, That would put you in the July 6th area. However, as I said before, the governor has offered that that's just the rule of thumb. You could perhaps see these stages accelerate. For instance, the differences between phase 1 and phase 2 is so nominally incremental, perhaps that accelerates. And then sort of you wait then the 2 weeks and see where you are. That would actually accelerate phase 4 up until early July as opposed to the second week of July. That's the expectation, 2 weeks between phases with the hope that they accelerate. Well, the expectation they could accelerate quicker based on what's safe and appropriate. We are approaching the end of the town hall. I am going to thank you all. Don't leave us just yet. Thank all of you for who've been on the line. I'm sorry we weren't able to get to all of your questions. We're going to be back together first next Wednesday. Next Wednesday, we have a Facebook Live event, and then the following Wednesday, June the 10th, we will. Oh, I'm sorry. Let me start again. This Friday, the day after tomorrow, we have a Facebook Live event. You'll be able to participate, so bring your questions then. Then we have another town hall again Wednesday and Friday of the following week, and then June 10th, we have another telephone town hall. Please join us for that. We have gone through a lot these last couple of months together, and I recognize the massive amount of stress, anxiety, and quite frankly, both human toll and challenges for businesses and those worried about a paycheck. That is all exceptionally real. Dutchess County this past weekend experienced yet one more loss. As we as a community said farewell to Barbara Jeter Jackson. Barbara was a dear friend and served in the Dutchess County Legislature since 2004. I've had the pleasure of knowing Barbara, serving with Barbara for nearly now 25 years. She was a Poughkeepsie School District board member from 1978 until 1994 and a member of the City of Poughkeepsie Common Council from 1996 to 2003. Barbara Jeter Jackson was a mother to many, a mentor to many, and they just don't make people like her much anymore. As a public servant, I can tell you that she never allowed partisanship to get in the way of serving her constituents. And she was always willing to work with somebody with whom she disagreed in the hopes that perhaps together they could find common ground. She was a woman filled with grace. Her heart was powered by love, and she always strived to do the right thing. Her calm demeanor, her compassion, and her kindness was a way of living for her. But beneath that was a strong and tireless advocate for the things she believed in and the people that she loved and the community she served. I can tell you that Barbara and I didn't share party affiliation, but you never would have known it. And I can tell you that she was, for me, a very personal friend. When I needed guidance and counsel in places and in neighborhoods that maybe I didn't have relationships, Barbara would be there to open the door, to offer advice, whether it be critical or complimentary. I can tell you that as we got to know each other even closer in these last several years, she was exceptionally kind to my family, my children. She welcomed them to Beulah Baptist, and I do want to note, exceptionally kind to my wife, Corinne. Corinne and I really, truly felt and believe and treated Barbara as a dear friend, and in many ways, Barbara treated us as family. On behalf of the nearly 300,000 people who call Dutchess County home, we're going to conclude today's town hall in memory of Barbara Jeter Jackson, an amazing woman for whom we are all benefited to have known. I can tell you that the county legislature, the county government, and Dutchess County as a whole is better because she served, better because she loved, and better because she cared. She is irreplaceable and will leave an enormous void in this community, one that I think in her memory and honor we should strive to fill with goodness, kindness, and decency toward one another. So on behalf of Dutchess County, good night, Barbara, but I know as she believes fervently, she is now home. She is home with the God that she trusts, the God that she prayed to, and the God that she loved. and one that she believed, as I do, loved her. So with that, ladies and gentlemen, thanks for joining us this evening. We'll be back together on Friday. If you have other questions for us, please reach out. You can always visit duchessny.gov. Good night. Continue to be safe, stay healthy, and be kind to each other.